A 70-year-old woman has nausea, vomiting, abdominal distension, and episodic crampy mid-abdominal pain. She has no history of previous surgery but has a long history of cholelithiasis for which she has refused surgery. Her abdominal radiograph reveals a spherical density in the right lower quadrant. Which of the following is the definitive treatment for this patient's bowel obstruction? Welcome back, viewers. Today we have an interesting case involving a 70-year-old woman who presents with several symptoms suggestive of bowel obstruction. Together, let's analyze the clues and eliminate the wrong answer to find the definitive treatment for this patient. Our patient's symptoms include nausea, vomiting, abdominal distension, and episodic crampy mid-abdominal pain. Additionally, her abdominal radiograph reveals a spherical density in the right lower quadrant. Now let's examine each option and determine the most appropriate treatment. Although the patient has a long history of cholelithiasis or gallstones, the symptoms and radiographic findings are more indicative of a bowel obstruction rather than a gallbladder-related issue. Therefore, we can confidently eliminate cholecystectomy. Now let's consider ileocolectomy. Ileocolectomy refers to the surgical removal of a segment of the ileum and colon. While it may be a treatment option for certain conditions such as Crohn's disease or colon cancer, it is not the definitive treatment for this patient's bowel obstruction at this point. Now let's focus on the remaining options. Nasogastric tube decompression is a commonly employed intervention to relieve symptoms and decompress the bowel in cases of bowel obstruction. It helps alleviate nausea, vomiting, and abdominal distension. Considering the patient's symptoms and the need for immediate relief, NG tube decompression is a reasonable first-line intervention. Lastly, we have ileotomy and extraction and IV antibiotics. While the patient may need IV antibiotics if signs of infection are present, it is not the definitive treatment for bowel obstruction. Therefore, we can eliminate IV antibiotics as the definitive treatment option. After careful consideration, the most appropriate definitive treatment for this patient's bowel obstruction is ileotomy and extraction. This procedure involves making an incision in the obstructed bowel segment and removing the cause of obstruction. In this case, the spherical density seen on the abdominal radiograph. Gallstone Ileus is caused by erosion of a stone from the gallbladder into the GI tract. The stone becomes lodged in the small bowel, usually in the terminal ileum, and causes small bowel obstruction.